I want to welcome everyone to the National Policies of Emergency Response, Trauma, Health Facilities, and Case Study panel session of our TAMEST Natural Hazards Summit. As a reminder for those of you that just joined us, my name is Hanadi Rifai. I am professor at the University of Houston and had the pleasure and honor of hosting part one of this Natural Hazards Summit in Houston last October. Today, I'm joined by a team of experts, and we're going to have another set of robust conversations. As I mentioned previously, the bios for all the speakers are on the TAMEST website. Please take a look and make sure to get to know them better. We're going to start with Moises Dugan. He is Region 6 Deputy Administrator of the Federal Emergency Management Agency. The second panelist is Andrea Jackman. Dr. Jackman is a senior consultant in data and risk sciences with the ABS group. And the third panelist is Dr. Karin Price, Chief of Psychology at Texas Children's Hospital. And as we've done all morning, after the panelists give their brief presentations, we will open the floor for Q&A. Thanks again for joining us this morning. Mr. Dugan?
All right, well, good morning, everybody.
Good morning.
Wow, it's still morning. Let me just say, first of all, it's great to be back in Lubbock. I am, in true transparency, been with the FEMA Region 6 office for over 7 years now, but I'm actually being reintegrated back in because I spent 8 months up in Chicago serving as the acting regional administrator up there. So I can check a Chicago winter off the checklist right off. The other thing I want to say is that I did come back to Lubbock one time while I was up there. It was to see my son graduate from Texas Tech with his mechanical engineering degree. So I'm a proud dad of a Texas Tech alum. So anyway, let me get on with the presentation at hand. First of all, it's great to have the opportunity. I certainly appreciate the invite to come speak to you all today at your summit and share a little bit about what the agency is doing and what we do at the regional office. And of course, at the end, be more than glad to take any questions you may have at the appropriate time. So with that, I'm going to hopefully get these things right. First of all, the FEMA mission is pretty straightforward. And I think is what drives the recruitment for our agency. And I don't want to start any presentation without talking about the fact that the mission of it is pretty straightforward in helping people before, during, and after disasters. So a lot of people know FEMA as someone involved during the response or the recovery phase of an event, but really there's a lot more that we do, and it's because of the mission. And it's not just what we do, but it's how we do it. And we do have, well, we take pride in our core values of fairness, respect, integrity, and compassion. And I bring up the last one primarily as a point of emphasis because if you look at other federal agencies within the federal family, you'll find very few that have that one particular core value. So it really drives how we do our mission as we go about all phases of emergency management. So this speaks to those phases of emergency management that hopefully most of y'all are familiar with, especially in the emergency management community. But it also informs you as to how our headquarters and our regional office aligns with the fact that you have the upper right and the lower right being part of our resilience directorate, or which encompasses mitigation and much of our preparedness activities. And as you know, mitigation, it really drives home those things that we can do to reduce loss of life and damage to property during any type of event, much to the topics that were just presented. Preparedness, of course, is that process in which we are doing plans, we're conducting training, and we're putting all that through exercises to see where some of our gaps may be in our capabilities. Of course, then you get to the left-hand side of the chart where it talks a lot about our response and recovery activities. So our response really focuses in on those life-saving, life-sustaining activities and anything that we can do to help prevent additional damage from occurring from an actual event. And then the recovery program is one that takes a lot longer, is the one you probably are very familiar with. And I'll talk more about the types of programs we deliver under the recovery process. But it is, of course, the final part of our emergency management cycle. And then hopefully from that, we've learned where we need to apply more resources or commit more of our time in mitigating and then starting that cycle over again. All right, just a brief overview of how our regional offices are aligned. Of course, like I said, I spent the last 8 months in Chicago, Region 5. But besides having our headquarters office, FEMA has 10 regional offices with Region 6 having the privilege of serving Texas, Louisiana, Arkansas, Oklahoma, and New Mexico, to include the 68 federally recognized tribes that reside within our 5 states. We are a very busy region. I would say probably along the likes of Region 4 out of Atlanta, which I also served as the Mitigation Division Director at one time. So we average around 8 to 9 disasters per year, major disasters per year, and we have over 800 staff that are committed to our mission. One thing I want to talk about is some of the risks that we face here in Region 6. Many of them are shown here, but just to give you an example, we are, again, very active, and we're only 16 days away from the start of hurricane season, which really denotes and kind of is our busiest time of the year. And already to date, we've approved 9 federal fire management assistance grants. They're not at the same level as a major disaster declaration, but they are showing that change in some of our climate and some of the things that we really need to be on guard for as we continue this conversation. But we have 9 fire management assistance grants declared in Texas and New Mexico so far. And just 2 weeks ago, we declared a major disaster declaration in New Mexico for wildfires and straight line winds. I want to talk a little bit about the COVID response, because I think it informs a little bit more about how we as an agency operates. But I think you'll all agree that some of the words like unprecedented and historic are often used to describe what we have all just been through. Hit us not just at the local level, but it hit us at the state and nation as well as the world. And in the early days of the pandemic, FEMA was asked to support our partner federal agency, primarily HHS, the Health and Human Services Department, in helping control the spread. And what that meant was the fact that there was not a lot of equipment that we had in the inventory to help in this type of situation. So partnering with our federal agencies, we worked to address shortages in medical supplies and ensuring surge capacities if hospitals became overwhelmed with infected patients. Then as the pandemic went on into 2021, there was a new, the mission changed as a result of the introduction of the safe and effective vaccines. So when the administration once again tapped FEMA to begin working to help with the distribution and administration of those vaccines. And so with that, we again partnered with all of our federal agencies to include CDC, the states, our tribal partners, and local jurisdictions to help establish federal community vaccination centers. And so we spent nearly half the year working in establishing these types of centers to administer the vaccines. And as a result, FEMA had assisted over 300 vaccination sites across the 5 states with equipment, personnel, and funding. And then just here in Texas, we've obligated over $14 billion to help address COVID-related projects. The other big thing I wanted to talk about is the role that is now a big part of our new FEMA strategic plan for 2022 to 2026, which is equity. The administrator, when she released the new strategic plan, really had a bold vision with a people-first approach, and instilling equity as a foundation of emergency management is the first of one of three high-level goals that she was wanting to stress within our ranks. The importance of equity, of course, is not new to emergency management. The Stafford Act, our enabling legislation, has always asked for us to deliver our assistance equitably. But what we've really have done is really try to simplify many of our programs so that they are reaching the people most in need through boosting access and reducing barriers. And just to give you a few examples of how we did that is during the vaccination mission, we really leveraged the CDC's Social Vulnerability Index as well as census data to help us target where we would want to put these centers. We looked at social vulnerability indexes of greater than 50% and population centers greater than a million to help select these sites, along with information provided by our state and local partners. We also look for ways to address and support the more rural and hard to reach areas by supporting vaccinations up to 250 vaccinations per day with mobile units. And then, of course, there was language barriers that we had to address, and we introduced a process in which we helped translate the assistance into 187 different languages to include online sign language interpreters and other document translation processes. Finally, we want to ensure that we had accessibility for everyone, so we ensured that we had stations designed for the special needs population to make sure the vaccinations were administered there. And then for folks that had transportation limitations, we leveraged Uber, Lyft, and other local authorities to help provide that type of assistance to and from vaccination sites. Of course, we don't, FEMA is just part of the team. The team is really made up of the federal, state, and local emergency managers, and so we just want to recognize this by saying that we are in a process of looking for ways to support the state and local emergency managers through emergency management curriculum and comprehensive training, education, and professional development. One of the things in the vision the administrator has is to make these more community-based training opportunities so that people, regardless of where you live, have access to that training. I want to talk a little bit about disaster declarations and the process that goes on here, but it really takes on excuse me, I didn't see the other part there. This is basically the flow chart of how disaster assistance works, but I will just summarize it by telling you that it really focuses on the assessment, much like the previous presenter talked about, the validation of those damages, and then looking at what the next steps might be from the standpoint of what would go into a governor's request to the president for the type of assistance that would be needed. All this is really driven by what is the needs based on those assessments and what is not covered by insurance or through a different federal agency. These are some of the treetop level programs that we deliver. Individual assistance is just that, assistance for individuals that go through central registration and have assistance up to $37,900. But I will tell you that our average grant under this program is much closer to $4,000. That's why we really stress the need for people to look at their risks and cover those risks through the appropriate insurance, whether it be general hazard or flood. Public assistance, most of the assistance goes out of this program. It's designed for state and local governments and tribal organizations and tribal nations to include certain private nonprofit organizations, really broken down into two types of assistance: emergency assistance for debris removal and emergency protective and emergency work such as fire, police, and ambulances, and then permanent work that covers things like roads, bridges, and other type of infrastructure that may have been damaged. And finally, hazard mitigation grant program is available to the state once a disaster is declared, and that is really intended to provide funds to, again, break the cycle. I don't want to pass the opportunity to really drive home the need to communicate the difference between flood insurance and general hazard insurance. This is where people, I think, really make don't fully understand what is coverable under their general hazard insurance. And so flood insurance is available to over 23,000 participating communities. Over 1,200 of those are here in Texas. This is one of those areas in where we are really wanting to maximize, because in reality, from year to year, it looks like there are more property losses, policy losses within our flood insurance than there is gains. And so we just really need to have people take a look at what their risks are and consult the floodsmart.gov website to see what is coverable and the cost associated with those that coverage for your own protection. So with that, I want to just close and say thank you again for the opportunity to present to you this morning. Certainly any questions you may have, we'll be glad to answer, and look forward to that at that appropriate time. Thank you.
Dr. Jackman? Now, I have to warn you, I think the microphones over there are on.
Well, thank you so much, and thank you for having me, especially to Dr. Mehta for inviting me today. It's a pleasure to be back in Lubbock. I never thought I'd be saying those words, but here we are. Almost 20 years later, I'm thrilled to be here today. And I also want to thank Moises for giving that excellent summary of what we do at FEMA on a regular basis. I'm currently a contractor with ABS Group, contracted to the FEMA Hazards Program. And I realized as we were hearing that last talk that I created slides sort of assuming that everybody already knew the acronyms and the inside speak for a lot of the federal response capacity. And as I was listening, I realized that it's best that we had that good overview before I got up here and spoke. But I just wanted to give a little introduction of myself and how I got here. As one of the former students of the multidisciplinary wind engineering program, I never imagined that I would be working in emergency management. I started out as a meteorologist in undergrad. I was chasing tornadoes at Valparaiso University. And as I was getting ready to graduate in 2003, we got a call from the Porter County Emergency Manager's Office in the meteorology department, and they said, there's this brand new Disaster Mitigation Act of 2000. There's something called a Hazard Mitigation Grant Program. We have no idea what to do to get funding. Can you send over a meteorologist to help us with the climatological aspect, the scientific analysis of the climatology? And we said, sure. And I went over and did the best I could. I think they got grant money eventually. I don't know. I left Indiana and graduated before that came to pass. But that was kind of how I got started in emergency management. And then, of course, came here to Texas Tech, where I was brought up to speed on the engineering side, the structural side of some of the hazard science that I had already learned. After I graduated, I went to work for IBM, again, right into the post-Katrina world of PCHEMRA. That was the Post-Katrina Emergency Management Reform Act. And at the time, as a contractor to FEMA, we were trying to implement a lot of the changes that Congress had mandated as a result of the federal response to Hurricane Katrina. And so I learned a lot about response in that aspect. Up until then, I had been working mostly in mitigation and the structural engineering side. But because of PCHEMRA and because of that job, I was able to learn a lot about some of the logistics side of things, the supply chain side of things, things that were needed to be updated and changed as a result of Hurricane Katrina. So I did that for a couple years, and then eventually got back to where I started in mitigation, and I moved over to the HAZAS program, and I've been there ever since. I believe we had an excellent summary of what you can do with HAZAS in real-time damage assessment in one of the previous talks as well. One thing I wanted to draw out today as a theme that I've noticed in all of these state and local and federal and academic and operational emergency management is a lot of the times we fail to ask ourselves if we're doing a good job. We fail to measure ourselves. There's one component of engineering that I haven't heard mentioned here today, so I'm going to mention it now, and that is industrial engineering. The wonderful toolkits that come along with management science, with process design, things like this that we could apply to emergency management. We could start applying them today, and I think we could really see some tremendous improvement in the things that we're doing. How do I advance the slide? There we go. Okay. So just to kind of illustrate that point, I set up a little quiz to keep everybody awake before lunch here. But think back to recent responses that we've had to different disasters. We'll talk about COVID, we'll talk about Katrina from a while ago. What are some of your general impressions at the different levels of government of how these responses have gone? Have they been good? Have they been bad? I'll start there. I'll give two hazards to start with. I don't know. Does anybody have any thoughts on Katrina that they just want to shout out and share? Yeah, I'm seeing thumbs down, kind of. Actually, though, if we apply those industrial engineering principles, process measurement and process design, Katrina was kind of a mixed bag. There were some things that actually went really well in Hurricane Katrina. One of those was the ground evacuation out of New Orleans. If you look at measurable standards for setting up contraflow, getting people out of a certain area into safety, they actually moved more people in a less amount of time than they expected for the state of Louisiana and Katrina. And so that was considered very successful. There's also a very successful aspect to the federal response from the U.S. Coast Guard. They did not wait for orders to be given when they saw that people needed search and rescue capacity, maybe stranded by floodwaters or stranded on rooftops. The Coast Guard just went in with their helicopters, their boats, they had the equipment, they had the correct training, and they saved, it's been estimated at least 10,000 lives, probably more than that. Local is where we think maybe things didn't quite go as smoothly as hoped. Part of that was the Hurricane Pam exercise had happened only weeks before that, and there was a lot of misinterpretation and miscommunication about what the local governments thought was going to happen if a big hurricane struck versus what actually did happen. So that's just something to keep in mind. That's the power of good measurement. When you have a process in place and you go in and you say, all right, is this really working or not? You can learn some interesting things. So how about COVID? Does anybody have any idea where we are with COVID? Because I certainly don't. I think we're still in the middle of it right now. We're going to learn a lot in the coming years, months, years, decades about what we did well, what we could have done better. I guess most recently at the federal level, we can say that Congress had a hearing back in January to assess FEMA's performance in COVID and overall found that they had done a really good job of supporting other federal agencies. Since pandemic, it doesn't usually fall under FEMA's purview for that. So I can't remember what I put in this red box. Yes, okay. This is why it's important to measure, because if we don't measure ourselves and if we don't apply some type of quantitative aspect to our processes that we've set up, if we don't say, well, does the Stafford Act really work? Well, did the Hurricane Pam simulation really work? If we don't ask ourselves that, We let politicians and the media decide it for us in emergency management. Unfortunately, emergencies, they sell headlines, right? They're glamorous. People want to see catastrophe, and this is what sells newspapers, unfortunately. And so if we don't control our own narrative about what's going on, and if we can't stand up there and say, hey, no, wait a minute, we were prepared for this, and we saved this many lives, and we saved this many dollars. If we don't have that, then we're letting somebody else dictate that narrative for us. So that's something that I'm just hoping to keep in mind with discussion. And just a couple other questions. I think it's funny that so many of us in emergency management come back to the Stafford Act, because here's another schematic, and we saw one in the previous talk as well, but I think the takeaway from looking at these diagrams of the process that we need to follow in an active response is coming from this Stafford Act, which was written in 1988. And if you think about it, we really live in a different world now. This is assuming that somebody who's locally impacted by a disaster, a local official with a landline telephone, is going to go out, assess the damage, decide what assistance they need, if their capacity to respond is overwhelmed. And if that's the case, they have to go back, they have to talk to the state, they have to describe and justify why they need assistance. The state has to take this into consideration, go up to the federal level, sometimes up to the president, and go through the whole process again. It's not conducive to a quick response. It's not conducive to saving lives when sometimes seconds can make a difference in the damage and the loss that we see. So this is just one example of where we need to ask ourselves, does this work? I mean, we've been doing this for so long. Is it really the best way of doing it? We can bring in principles from business management, from process management, process engineering, industrial engineering. We can apply all those things for maybe some new directions in research. I also have some questions that I'm not going to read through each one. Just I was thinking if we needed to get a discussion going, but I think we already have plenty of topics here to talk about today. So I think with that, I'll wrap up quickly, and thank you very much.
And our third speaker is Dr. Price. There you are.
Hello, everybody. Just for some context, so I'm a psychologist. I'm going to come to today's conference with a bit of a different lens and maybe provide some different information. I really enjoyed the times where we've been discussing the role of social scientists in shaping communication that can have an impact on human behavior. Unfortunately, that's not what I was invited to talk about today, so maybe next time. Instead, I'm going to be talking about the impact on children's mental health when we have disasters, and really focusing on what policies we can have that will mitigate the risk. So Tracy talked a little bit about field observations. These are my much less sophisticated field observations from Hurricane Harvey, and using these photos to really think about how children are impacted by disaster. So thinking about waiting it out, waiting while the floodwaters were rising in their homes and in their communities. Some pretty spectacular rescues that also have the ability to be really traumatic for those participating in them. Sleeping in strange places. We see a young dad sleeping with his 1-year-old in the convention center in Houston. And then on the bottom, I think, over there, children having to help their families go through the rubble and rescue the belongings that they could and say goodbye to things that might have been very personally meaningful to them. But this one is my favorite field observation, because this one shows resilience. These are two sisters dressed in their swimsuits catching tadpoles in the puddle that was left after the floodwaters receded from their property. So today I do want to make sure that we're emphasizing and talking about resilience and how we can foster that. So thinking about disaster mental health, we know that there are some very immediate risks, so immediate physical harm. More so than adults, kids are at risk for negative health impacts. They have different respiratory rates, their skin is less thick than our adult counterpoints. They're much more likely to lose body heat quickly. They respond more negatively to fluid loss. There are lots of different risk factors there. But they're also really at high risk for indirect harm, meaning when the people around them who are supposed to be taking care of them are also impacted by the disaster. They also have lots of longer-term risks, so we know that kids that have been exposed to natural disasters have more physical health problems, more mental health problems, and more learning and school-related difficulties. But if we understand what we can do in the immediate term, we can reduce the risk for these longer-term consequences. So just for some data, I have to put on my glasses. About 14% of kids throughout the US have experienced disaster. And when you look at kids that have experienced one disaster, about a quarter of them have then experienced subsequent disasters. So we have this potential for compounded trauma. About 30% of kids who've experienced disasters experience some post-traumatic stress symptoms in the aftermath, and about 15% go on to actually meet criteria for a diagnosis of post-traumatic stress disorder, which requires a different constellation of symptoms over time and impairment in functioning. Somewhere between 2 and 69% of kids might experience depression after a disaster, and these really, the data really depend on which study you're looking at, what the methodology is, and what the disaster is that we're looking at. We know that some percent of kids also experience what we would call externalizing problems after disaster, so acting out behavior, substance use. There's some data here, but it tends to vary quite a bit, and it hasn't been the focus of a lot of studies. And then finally, we know that many years after disaster, almost a third of kids continue to experience symptoms. And overall, a higher portion of young people develop mental health concerns following a disaster than adults do. But not all youth respond in the same way. So we know that when we look across studies, youth demonstrate predictable patterns of symptomatology and recovery. So the graph that you see here is based on the Nepal Earthquake from 2013. Specific numbers change a bit depending on what disaster we're looking at, but the overall patterns are pretty consistent. So if you kind of start at the top with the blue line, those are kids that experience chronic post-traumatic symptoms over time. We also have kids that recover, so they might experience significant symptoms in the short term, but over time, their symptoms decrease. We've got kind of the stable low group where they have symptoms that don't tend to go up or down, they just kind of tend to persist. And then really importantly, on the bottom, you see our resilience group. So what do these data show? We know that nearly all kids who have symptoms show a decrease over time, and most of that recovery is happening in the first year after the disaster. So again, thinking about what are the immediate responses that we can put in place to mitigate risk. We also know that the majority of children show resilience, and knowing what predicts which category children might fall into can really help us to prevent long-term concerns, but also to shape policy to help them out. So how do we know which children are most vulnerable? There are a few factors that we need to consider. So kind of starting at the top, we have the type and severity of the disaster. So there is somewhat of a dose-response relationship here. So when we have a disaster that has higher intensity, we know there's more likelihood of increased symptoms or negative outcomes. But we also know that there are some very specific characteristics of natural disasters that place kids at higher risk. And that's typically when they have been exposed to the death of somebody or when they have believed that their life was in danger as a result of the disaster. There certainly are caregiver and family characteristics that influence outcomes. We know that the availability of parental support following a disaster is the single best predictor of a good outcome. Interesting, we also know that if a child has a parent or a caregiver who's a first responder, they are at higher risk for developing mental health symptoms later on. Similarly, if a parent dies or is in the hospital due to extended illness or injury, and that particularly when the child can't see them, as we saw with the COVID pandemic, or we're seeing with the COVID pandemic, can have some pretty significant negative outcomes. Thinking about child and youth characteristics, we know that kids that have experienced prior trauma, so trauma before the natural disaster, or even trauma after the natural disaster, are more likely to experience negative outcomes. That cumulative risk comes into play there. And then community characteristics, so really thinking about marginalized communities, communities that start off with lower resources, have children who are at higher risk. We also know that when whole communities are gutted by a disaster, kids don't just lose access to their homes, they lose access to their schools and to their soccer clubs and to their places of worship, and therefore also lose access to the people in those places who care about them, who protect them and keep an eye on them. So their coaches, their teachers, their school administrators, their religious leaders. We also know that missing school is a huge predictor of negative outcome for kids. So how do we mitigate the risk? How do we start to think about this? The idea of a tiered intervention system works really well from a public health standpoint, but also from a prevention science standpoint. And this doesn't just apply to disasters. We use this same tiered approach to lots of different things, like bullying, for example, or traumatic events like the death of a student by suicide in a high school and responding to the other students in that school, or even chronic and life-threatening diseases like cancer or type 1 diabetes. The idea here is that when you're looking at Tier 1, these are universal interventions. They are applied to a broad group of people, some sort of catchment area or group of people, not necessarily those that have actually experienced any particular stressor. But when you move to Tier 2, those are the targeted interventions that are then aimed at people who've had a particular experience, but not necessarily at those who are demonstrating any signs of negative outcome. Tiers 1 and 2 aren't mental health interventions, but they do mitigate the risk of mental health concerns later on. And access to these things that are in the box there on the side really does depend on policy and on funding. Tier 3 interventions actually are the mental health interventions, and I don't need to go into them here other than to say that it's really important that these interventions are evidence-based and developmentally appropriate. We know that there are risks when very well-meaning individuals try to implement supportive activities like asking children to talk about the trauma, asking them a lot of details about what might have happened, what their experience was like during the disaster. But we mental health professionals understand that that actually can contribute to higher post-traumatic stress. And so finally, how do we think about mitigating the risk, building resilience, and promoting recovery? There are a few different important areas. At the top, we have increasing access to evidence-based mental health services. This isn't just in private therapy offices or in hospitals like where I work. Kids that already have resources and have insurance are going to access mental health when they need it. But instead, we're talking about making sure that there's access to evidence-based support and mental health services in schools and in communities, so that those who experience barriers to access, whether that's transportation, whether that's not having insurance, whether it's homelessness, or being a newly arrived immigrant, we need everyone to have access to those services. The green box there is about supporting coping by parents and caregivers. Above all, the single most important protective factor is having that stable, nurturing, safe caregiver. And when those caregivers aren't able to be there for whatever reason, we need to be able to find people who can step in to support kids. Investing in school infrastructure and remediation. So as I said before, missing school, number of school days missed, is a risk factor. But one thing we've really learned from the COVID-19 pandemic is that when kids aren't in school, their mental health suffers, not just because of natural disasters, but for all different reasons. And then finally, thinking about addressing psychological preparedness for disaster. So this is kind of a newer concept, but it's sort of the idea that just like preparing your home to mitigate risk, you can prepare your family to mitigate mental health risk. So as we're giving people warning of impending disasters, as we are providing instructions for fortifying their homes or evacuating safely, we can also be preparing them for what they can expect from themselves and from their children in the aftermath of a disaster. So providing providing support, deploying mental health teams earlier, engaging, excuse me, community partners in providing these universal interventions to promote resilience can be really important, while also arming people with the information to be on the lookout for kids who are at higher risk and getting them to those evidence-based interventions as quickly as possible. Thank you.
Excellent. Thank you so much, all of you, for your wonderful speeches. So I'm going to start us on the Q&A session and ask a few questions, and then I'll open the floor for the audience to do so. So I'm going to start with Mr. Dugan and ask you very briefly to let us know what are some of the lessons that the agency has learned since Katrina that have informed and shaped your current thinking about how to respond to natural disasters?
Yeah, that's a good question, and I think one thing that really comes to mind is something that was stated earlier, and that is we really have moved away from kind of the progressions that we have as terms of our sequence of delivery, such that we're not waiting for requests to come in as much anymore as we are pushing resources out that we might need in the with the understanding that we can deploy resources to like a forward staging area or to a facility that we have much closer to the damage area, with that, but not necessarily having to push it on anybody, especially if it's not requested by the state, but rather have it available for that immediate response. And so one of the things that we've really been focused in on is not being late to need. And so just as a quick example is the fires that we have going on in New Mexico. When we got the declaration, although there was not a request yet for the need for generators, we automatically pushed a significant number of generators forward to our staging area to have available to support the state if they needed it. Similarly, we also didn't have a request for housing units for that event, and we are already pushing housing units that may be needed because of lack of availability of housing stock in New Mexico. And then third, just for our responders, there's not been a request yet for it, but we've also pushed out responder lodging modules. So that's really changed the mindset within FEMA, so as that we're not late to need, we're pushing things forward, but not necessarily we're deploying them without necessarily employing them without the request from the state.
Thank you. My next question is for Dr. Jackman. And you asked a very good quiz, so I hope we passed, first of all. So my question to you is based on what you've observed over the past few years. How have communities become more engaged in emergency management and recovery?
That's a good question. It's a challenge because a lot of the times what we see are we'll have a disaster, and then usually the first group to take action will be federal level, or the policymakers will come in and say, like the camera, what can we learn from this? What are the lessons learned? Um, And so we end up with these broad, sweeping national policies that don't always apply at the local level, or can be very difficult to implement at the local level because they were designed on a national scale. I think more recently, people are starting to realize, just as the Stafford Act intended and just as some of those policies intended, that uh, they have the most knowledge of their own local communities and therefore the most control over their response at the local level. And I'm encouraged by that because I think the more we can encourage the local communities to take action and be prepared and do some of the work that maybe previously they were expecting FEMA to do for them or another agency to do for them, the less we can get away with that or get away from that and encourage the local community to take their own initiatives, the better. I don't know that we're quite there yet, but I see a trend in that direction.
Thank you. And my third question, I guess, is for Dr. Price. And I want to probe a little bit what your thoughts are in terms of the different response for COVID from the children's perspective. So in a way, they were discouraged from social interaction. They had to wear masks and do things that normally we do quite the opposite in, engaging children in society. So how do we get back from that?
Great question. The COVID-19 pandemic has had unprecedented impacts on children's mental health. We probably can't get away from hearing that over and over again. At Texas Children's, I'll just share a little bit of data. We are experiencing this at every entry point into our system. So prior to the pandemic, if we look at 2019, we had about 40 or 50 kids per month on average presenting with behavioral health crises in our emergency centers, so across 3 campuses. Now we average more than 400 a month. So the number of kids that are coming into the system with significant depression, suicidal ideation, and suicide attempts has overwhelmed the system. And we try to think about why. Why is this happening? At the beginning of the pandemic, we thought that it was related to, routines being disrupted, a lot of uncertainty and stress, being out of school, and in being out of school, being disconnected from their peers and their social supports, but also spending a lot more time on social media. And we're starting to see sort of some data come out about the negative consequences of that. That all is a fine explanation, except if you look now, we're 2 years plus into the pandemic, and we're only seeing the rates increase. We're not seeing them go down. And so trying to think about why that is, and I think some of the things that I talked about today in terms of promoting risk are very inherent to the pandemic. So we know that there was school missed. We know that entire communities were impacted. We know that more than 1 million Americans have died from COVID, and for each of those Americans, there are on average 2 children associated with them, whether it's a child, a grandchild, niece, nephew, cousin. And so I think some of the things that we've seen in natural disasters that have are associated with negative outcomes are actually inherent to the pandemic, and we're not quite sure what it's going to look like over the next few years, other than saying we haven't seen the decrease that we hoped that we would see when things got a little more normal.
Thank you. Well, in the remaining few minutes, I'd like to give you all the opportunity to ask questions. Does anyone wish to? Glenn?
So, speaking about the New Mexico fires, as someone who has a home up here in the middle of it, so when FEMA goes in after something like this, which is going to be a major disaster, I mean, it's, I don't even know how many structures, villages, people have lost their homes, their livelihoods. How long does FEMA stay? And once you decide that your work is done, how do you know, who do you hand it over to in a situation?
Right. The recovery process is by far the longest, and it's based on how people were positioned prior to the event, whether it's, there was a lot of insurance, no insurance, 2 different outcomes and timelines that would be associated with that. We did declare, there was a major disaster declaration declared for New Mexico. 5 counties were involved in that. Doesn't mean it's going to stay there. It means that that's where we started, all subject to additional assistance in counties being added. As far as the delivery of assistance, and we'll dictate how long we're there. We work really, we obviously work hand in hand with the state to work the timelines on when they're able to do what they need to do. We get our grant programs implemented, and of course, all that will probably, throughout the course of recovery, depending on what we're looking at, will all start when it's safe to do so, based on the fact that we do have still active fires. But I would say that some of the assistance that we're talking about, based on the infrastructure, will be several years in order to fully get the assistance pushed out that we can, and then it's a matter of then getting that work completed based on the assistance provided, not just by us, but with our other federal partners, such as the Small Business Administration, HUD, and anyone else that may be involved. I know the U.S. Forest Service, and their folks are obviously fighting the fires actively on the operational side of it. But there are so many other federal agencies that will have a part of, and as well as state agencies will have a say in how long that will take.
Thank you.
My question is to Dr. Price, Chris Letchford from Rensselaer Polytechnic Institute. My question is, how much would you attribute the American education system and perhaps parenting styles to the lack of resilience in American children today?
So I'll start by saying I worry a little bit about classifying American children because we know there's tremendous variability based on sort of culture, location, family status, those sorts of things. You know, I do think that one of the areas where kids suffer the most is exposure to media. I was speaking with a group last week where I just kind of said, you know, when I was a kid, if bad things were going on in the world and my parents didn't want me to know about it, they just turned off the television, right? We just didn't watch the news. And now kids get that information, you know, 24/7 immediately accessible. And so I do think there is a big part of what's happening with kids and lack of resilience that has to do with that. And as it relates to parenting, you know, how well are parents doing with monitoring what their children are doing in their free time? So yes, you know that when your kiddo's on his iPad, he's watching YouTube, but what's he watching on YouTube? And so I do think that there are some pieces there that are around balancing balancing accountability and development of autonomy for kids that definitely come into play. And I think that our school system, if we're thinking about our public school system, you know, for the most part, demands are high and funding is low and people are doing the best that they can, but that doesn't always mean that it's the best that could be happening with different resources.
Thank you. One last question.
Hi. So my question is to Karin Price. So in 2015, there was a massive earthquake in Nepal, and I was there. And you know, it has led me so many psychological problems with the people, and it was there in the people's head for a long period of time, and many people died in that incident as well. And when I went to India for my undergrad, so there was tour to science club where students were taken to the earthquake simulator room. And I was so afraid to go inside there because I have already felt that in the real world. And that has stayed there for me a long time, but I have finally overcome that. And in Nepal as well, you know, after the earthquake, people invested on the infrastructure, to rebuild infrastructures and everything, but nobody talked about the psychological effect that it has created on the people, and especially on the child. So my question is, what should be done? It should be, you know, people should be aware of this before the, you know, such disasters, or it should be after the disaster, and what would be the efficient way of doing that?
Sure. So, you know, the things that you talk about experiencing, those are post-traumatic stress symptoms, right? So re-experiencing, having anxiety, avoiding things that remind you of the disaster, those are kind of the core pieces of post-traumatic stress. And we know, I showed the graphs, lots of people are going to experience that initially. We also can expect that most people with, you know, basic supports will see those symptoms go down. For people that experience them in a more extended way, so either over a longer period of time with greater intensity or with greater impairment in daily functioning, those are people that really need intervention. So kind of moving to that tier 3 of, you know, of services. So I think what we can do sort of before the disaster is that sort of mental health preparedness, letting families know your kids are going to probably be upset about this for a period of time. They might have nightmares, they might want to talk about it, they might not want to talk about it. All of that stuff is normal and okay. Your job is to support them, to answer their questions in developmentally appropriate language, and to just be on the lookout, because we should see those difficulties decrease over the next several weeks or months. If we don't, here's some resources for where you can get.
Thank you. One last question.
This will be very brief. I wanted to ask Dr. Jackman, how would you redesign the Stafford information flow to improve it and make it appropriate for this century?
A short question.
That could be a whole nother thesis. Briefly, the first thing I would do is remember that now we have the internet. we have, that system is designed for landline telephones, no satellite imagery, no damage assessment capability, maybe not even walkie-talkies. And think about what we have. I mean, you just need one person with a phone now, and you can skip ahead of how many steps. And, that was a short
All right.
answer.
Well, this is a good place to stop. I want to thank our panelists. Thank you so much for your time and your expertise.